Lifestyle Medicine for COVID-19 and NCD Care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, Simply Nature, and the Foligo.
Evidence-based, clinically researched, lifestyle medicine aligned natural supplements effective for metabolic syndromes such as diabetes, blood cholesterol, for cancer, and other immune deficiencies. That's Simply Nature products for you. Simply Nature products are plant-based whole superfoods. Our tablets are lightly processed, and our unique microalgae is simply just cleaned and then pressed into convenient chewable micro tablets. Our extracts are concentrated without using chemical extractions from our microalgae. They are natural, safe, and do not have any known contraindications with medication. And again, our extracts are natural concentrates of our microalgae. They are powerful gene activators and rich in cellular nutrition such as phytonutrients, PPAR agonists, and CGF. Now we've covered how Simply Nature products is effective as a foundational prescription for lifestyle medicine protocols. It has an incredible nutritional profile, but more importantly, it is a gene activator that will help you get consistent and effective results for your patients.
Now, let us gather once again. This coming September 30, 2021, we are going to have a doctor's forum discussing on how our PPAR's protocol works to your cancer patient at the same time to your COVID patient. And this is 100% free for all PCLM participants and members. So, sign up now!
Dr. Jansen Calalan is a consultant of the Simply Nature International, Calalan Philippines, Highland Medical Wellness Center, and a company physician at Hillmarks Construction Corporation. He is the president of the Four Leaf Lifestyle Medical Group. He had his Bachelor of Science degree in pre-med physics and graduated cum laude, and acquired his degree in medicine at St. Luke's Medical Center College of Medicine. He is a diplomate of the Philippine College of Lifestyle Medicine and the International Board of Lifestyle Medicine. Dr. Jansen Calalan will talk about allergies, the immune-gut interplay.
Good day to you. My name is Dr. Jansen Calalan, and I will be discussing the relationship of the gut microbiome and allergies, its clinical significance, and ways on how we can utilize our microbiome in preventing and treating diseases. Okay, for my disclosures, I am the president of the Four Leaf Lifestyle Medical Group, where we conduct intensive therapeutic lifestyle change programs such as the CHIP program. I am a consultant in Calalan Philippines, where I do primary care consults. I am also a consultant in Simply Nature, where I also do consultations. They are a distributor of PPAR's agonist cleansing, which is a fiber supplement, and AD Pro, which is a probiotic serum used in treating atopic dermatitis. Okay, so what is the microbiome? The human microbiome is composed of bacteria, archaea, viruses, eukaryotic microbes that reside in and on our bodies. They can be found in our gastrointestinal tract, respiratory tract, skin, in the urogenital area. So these microbes have tremendous potential to impact our physiology, both in health and in disease. They contribute to our metabolic functions, protect against pathogens, educate the immune system, and through these basic functions, affect directly or indirectly most of our physiologic functions. For this discussion, we will be focusing on the gastrointestinal microbiome. The gut microbiome has approximately 100 trillion microorganisms, represented by 300 to 1,000 different species. The gut microbiota are integral to host digestion and nutrition, and they can generate nutrients from substrates that are otherwise indigestible by the host, such as dietary fiber, which is also known as complex carbohydrates or resistant starch. Dietary fiber is transformed by the gut microbiota through this pathway. It can be produced in two ways: via butyrate kinase, leading to the formation of butyryl phosphate, and acetate transferase, leading to the formation of butyrate. Butyrate is then utilized by the colonocytes, immune cells, adipocytes, and liver to enact their physiologic functions. Next, let's focus on the role of butyrate in the immune system. Butyrate promotes epithelial barrier function since the primary fuel of colonocytes are short-chain fatty acids like butyrate. Well-nourished colonocytes mean healthy colonocytes, and healthy colonocytes mean good epithelial barrier integrity. Butyrate also promotes the development and activity of anti-inflammatory populations, such as regulatory T cells, while suppressing immune cell functions contributing to inflammation. Furthermore, exposure of the mononuclear cells, such as neutrophils, macrophages, and dendritic cells, inhibit inflammatory cytokine production. Mast cells play a central role in initiating and maintaining inflammation, particularly in asthma and allergies, in which allergen re-exposure induces IgE-mediated mast cell degranulation. Degranulation initiates the release of numerous inflammatory mediators and subsequent downstream signaling. Responses initiate the production of inflammatory cytokines, including tumor necrosis factor alpha or TNF-alpha and interleukin-6 or IL-6. So what about the role of butyrate? The role of butyrate had been speculated that it reduces cytokine production in inflammatory mediator release. The researchers then tested ovalbumin, which is an egg protein, onto the airways of guinea pigs. And they found that butyrate inhibited IgE and allergen-induced airway contraction in a concentration-dependent manner. The more butyrate, the larger the inhibitory effect. This is without butyrate. As you can see, airway contraction happened when it was exposed to ovalbumin. But with butyrate, the airway remained more patent with higher concentrations of butyrate. However, this is in a guinea pig model, so what about humans? The researchers went on to test butyrate on human mast cells, and they found similar inhibitory effects on mast cell degranulation. The higher the butyrate concentration, the stronger the inhibitory effect on mast cell degranulation and pro-inflammatory cytokines. Now, this is on a laboratory setting, but does this translate clinically? We know that fiber is only found in plant foods. So eating a diet high in plant foods would give you high dietary fiber to feed your gut microbiome and produce abundant amounts of butyrate. So these researchers did a cross-sectional study which looked into the frequency of allergies among omnivore, vegetarian, and vegan endurance runners. Now, it is known that endurance athletes are more likely to have allergies up to 5 to 6% more than the general population. However, the researchers found that those athletes following a vegan diet developed allergies less frequently than their omnivore and vegetarian counterparts. Now, how about in kids? Here's a study where the researchers found that long-term fruit intake among children 2 to 8 years of age showed 10% less likely of developing asthma symptoms and sensitization to allergens. More than 3 times a week of fruit intake showed 13% less likely of wheezing from asthma and 14% less likely of developing severe asthma symptoms in children aged 6 to 7 years. For vegetable intake, it was 12% less likely to develop wheezing and severe asthma symptoms. Now, this is for the respiratory symptoms. What about for the skin, especially atopic dermatitis? No? So, is there a role for the gut microbiome or perhaps the skin microbiome in the manifestation of this illness? Okay, so atopic dermatitis or eczema is a condition that makes your skin red and itchy. It's common in children, but it can occur at any age. Atopic dermatitis is long-lasting, so it is chronic and tends to flare periodically. It may be accompanied by asthma or hay fever as well. Okay, so this study described two pathways that causes atopic dermatitis: barrier dysfunction and an imbalance between T helper and Th2 cells. This imbalance then induces secretion of cytokines that leads to high production of IgE, which increases the binding of Staph aureus to the skin. This is the reason why Staph aureus is the most common pathogen grown from atopic dermatitis flared up skin. So now going back a little bit, butyrate suppresses both dendritic cell activation and migration to local lymph nodes, where activated dendritic cells function to stimulate immature or naive CD4 positive T cells to polarize the Th2 lineage. In the B cell compartment, butyrate suppresses both B cell isotype class switching and plasma cell differentiation, leading to decreased levels of circulating IgE. Furthermore, butyrate inhibits IgE-mediated mast cell degranulation. Now, with the inhibition of the Th2 lineage, the secretion of Th2 cytokines is decreased, which decreases the binding of Staph aureus to the AB skin. This is how a plant-based diet is able to regulate atopic dermatitis flares by way of our gut microbiome. Now, we all know that telling the patient to change his or her lifestyle may not work immediately. A lot of motivation and behavioral adjustments needs to be done, and immediate solutions are needed, and most often even preferred by most patients. So here are some products that I use for my patients. Foligo is a prebiotic supplement, and Cleansing Plus is a psyllium husk with antioxidants supplement. Okay, so both are fiber supplements which are really great for bowel movement. But do they increase the production of butyrate? Okay. So here is a study looking into the effect of psyllium husk on the production of butyrate. Now, the researchers have found that when they gave the participants psyllium husk, the fecal water content increased. Okay, so as fecal water increased, it also increased the butyrate-forming bacteria such as Lactospira, Roseburia, and Faecalibacterium, which went on to produce butyrate. So these are butyrate-producing bacteria or probiotics inside their gut. Okay, so now how about if we give patients probiotics instead? Okay, so the researchers found out that if probiotics are given both during the prenatal and postnatal period, it can decrease the risk for atopic dermatitis in infants and children by 31%. And they concluded that probiotics must be given during gestation and be continued until the first 6 months of the infant's life. Okay? Now, would this persist even after stopping the probiotic supplement? This study investigated the effect of Lactobacillus fermentum given twice a day for 8 weeks among children 6 to 18 months of age, and then after which they were again assessed after 16 weeks, no, after stopping the probiotic supplement. Okay, and the researchers compared the severity scoring of their atopic dermatitis, and then as you can see, at 8 weeks, there were more children in the probiotics group which have mild symptoms compared to the placebo group. Okay? The number of children who had moderate atopic dermatitis also decreased in the probiotic group. When the researchers followed up the participants at week 16, they can still observe the same pattern. Okay, so what we can conclude from this is that the effect of receiving probiotics can persist even after stopping the probiotic supplement. Okay. The reduction here is the stored index score, no? So the SCORAD measures the severity of the atopic dermatitis among the participants. So here we can observe that the reduction in the SCORAD index over time was significant in the probiotic group, but not in the placebo group. Okay, so significantly more children receiving probiotics had a SCORAD index that was better than baseline at week 16 compared with the placebo group. At the completion of the study, more children in the probiotic group had mild atopic dermatitis compared to the placebo group. Okay. Now, how about for the skin? Can we use topical probiotics to manage atopic dermatitis? So it is known that Staph aureus is the most frequent isolated bacteria in patients with atopic dermatitis. Staph can produce exotoxins such as staphylococcal enterotoxins, A, B, C, D, and the toxic shock syndrome toxin, okay, or the TSST1. So these infectious agents may function as super antigens that causes pro-inflammatory immune response and may also act as an allergen. So if we eliminate staph, might we be able to improve the symptoms of atopic dermatitis? Now, we know if we use antibiotics, we risk antibiotic resistance because we're just going to use antibiotics repeatedly, considering the fact that atopic dermatitis is a highly recurrent illness. We know this is not sustainable and we're just going to be putting the patient at a greater risk. So what if instead using antibiotics, we just use another bug to kill the staph bug? Okay, so this study investigated Bacillus coagulans, which is a very common probiotic strain available commercially. So the researchers showed that indeed Bacillus coagulans has antimicrobial effects against Staph aureus. However, this is on a petri dish. We won't know until we put it to the test. Okay, so here comes AD Pro, which is a probiotic serum that contains Bacillus coagulans and other probiotics such as Bifidobacterium, Lactobacillus. And the shelf life of B coagulans can last up to 36 months. So it is a pretty stable strain of probiotics, and the product itself is actually pretty stable. Okay. So here are some of the results the first phase of the study produced. No, this patient had atopic dermatitis for 7 years, and after a single application of AD Pro, this is the result after an hour. So we can notice improvements in the redness of the skin, though not really that much, but yeah, the skin was more moisturized and the redness was decreased compared to an hour before. So here we can deduce that, yeah, giving probiotic topical treatments can actually give immediate effects. Okay, so here is another patient who had atopic dermatitis for 4 years, and after a once-a-day application for 2 days, the erythema improved and the scaling disappeared. Okay. So as you can see, no, the scratch marks previously was already gone by the second day, or perhaps improved. Okay. So here, in this patient had atopic dermatitis for 2 decades. So prior to the application of AD Pro, the patient had erythematous plaques with scaling. Okay, so after a twice-a-day application of AD Pro for 7 days, the erythema decreased and the plaques regressed into a patch. So the plaques actually flattened out, although there were still scaling and there were still a few wounds that, of course, would have to be should heal in after a while, no? So it's not perfect, but the improvement is really noticeable. Okay. So here is another patient who had atopic dermatitis for 3 years. So this is a child who had atopic dermatitis or eczema on his right hand. Okay, so here we notice that before application of AD Pro, we have multiple erythematous macules, no? Also with scratch marks, with abrasions because of scratching, and then scaling. And then after application, after a once-a-day application for 3 days, we can notice that the erythema subside, although of course the abrasions are still there. So yeah, this will still need time to completely heal. Okay? And another thing that you can notice here is that before application, you can see significant scaling on the eczema of the child, no? But after application, the scaling decreased. Now, this child also had atopic dermatitis for 3 years. So before application of AD Pro, the child had erythematous plaques with dried wounds because of scratching, no, with abrasions, multiple abrasions because of the scratching. And after application of AD Pro for twice a day, for 4 days, the erythema disappeared. And as you can see, the abrasions also healed as well. Okay, there were no noticeable areas of scratch marks or abrasions anymore. Okay, so here is another patient. This is a patient with atopic dermatitis for 12 years. And after twice a day application of 3 days, the erythema regressed. So as you can see here, the erythema was up until here on the lower part of the leg, no? But after application of AD Pro, the redness subsided. Okay. So here we again have a patient who is suffering from atopic dermatitis for 20 years already. So her rashes actually was present on the anterior part, the antecubital area of her arm. No, so here we have an erythematous patch with abrasions again because of the scratching, with significant scaling as well. So after application of AD Pro once a day for 7 days, the patch already disappeared. Okay, at least the borders disappeared, but you can still see some redness. But the abrasive marks actually were significantly decreased already. Actually, it's near completely healed. Okay. So here is another patient with a 10-year history of atopic dermatitis. After a once-a-day application for 7 days, again, the erythema and the scratch wounds, the abrasions were gone. Okay. So now, this is just the first phase of the study. They did not have any controls or randomization or placebos. They just tried to see if the product produces any meaningful improvements. And so far, it did. Now, more studies need to be done for us to standardize the treatments, for us to know which protocol works and which doesn't. As you can see, in the case studies, some had significant improvements while others don't. A randomized placebo-controlled trial must be done as well so we can eliminate biases, know how much it can reduce atopic dermatitis severity and for how long. These are the questions that still needs to be answered, but nevertheless, the patients are satisfied, which is really the point of it all. Okay? So that ends my presentation. I hope you learned a lot, and thank you for your attention.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call.
Evidence-based, clinically researched, lifestyle medicine aligned natural supplements effective for metabolic syndromes such as diabetes, blood cholesterol, for cancer, and other immune deficiencies. That's Simply Nature products for you. Thank you, Dr. Johan, for the strong endorsement, and also a big thank you to the many doctors that have worked with us over the years to successfully support and treat patients. Nutritional supplementation for therapeutic effect. Every successful treatment protocol needs a strong foundational anchor. For lifestyle medicine, Simply Nature PPAR series provides that foundation. The key advantage and effect is how our Simply Nature tablets and extracts are able to unlock and magnify the benefits of lifestyle medicine. The key word here is epigenetics, gene activation. The unique phytonutrients and PPAR's agonist combination activates genes, initiating pathways that modulate the immune system, inflammation, metabolic processes, and cell delineation. Switching on these pathways kickstarts your patient's body to respond to the lifestyle changes and protocols you will be prescribing them. Simply Nature products are plant-based whole superfoods. Our tablets are lightly processed, and our unique microalgae is simply just cleaned and then pressed into convenient chewable micro tablets. Our extracts are concentrated without using chemical extractions from our microalgae. They are natural, safe, and do not have any known contraindications with medication. Let's take a look at the amazing nutritional profile of our Simply Nature PPAR micro tablets. Just 4 grams of our micro tablets is equivalent to 140 grams of mixed vegetables, or 1 cup of mixed vegetables. 4 grams of our microalgae has more protein than 140 grams cup of mixed vegetables. In fact, our microalgae is 60% plant protein with the complete amino acid profile, which is not found in vegetables. It contains the highest CGF found in any microalgae. It's rich in phytonutrients, rich in minerals, rich in vitamins. Just take a look at the full profile that's being shown on your screen right now. And again, our extracts are natural concentrates of our microalgae. They are powerful gene activators and rich in cellular nutrition such as phytonutrients, PPAR agonists, and CGF. Now we've covered how Simply Nature products is effective as a foundational prescription for lifestyle medicine protocols. It has an incredible nutritional profile, but more importantly, it is a gene activator that will help you get consistent and effective results for your patients.
Now, let us gather once again. This coming September 30, 2021, we are going to have a doctor's forum discussing on how our PPAR's protocol works to your cancer patient at the same time to your COVID patient. And this is 100% free for all PCLM participants and members. So, sign up now